Hello and welcome back. I'm Dr. Lisa Zadinak, also known as Dr. 212 Renew, and today I'm going to show you the carboxytherapy procedure for stretch marks. Carboxytherapy was discovered in the 1930s in France, and later the Brazilians picked it up, and now carboxytherapy clinics are as popular as Starbucks are here in New York City. When you go to Sao Paulo, everywhere you look there's a carboxytherapy clinic. And it's being used there primarily for body sculpting, a non-invasive way to dissolve fatty deposits. It doesn't involve any drugs or dangerous medications. And it's also used for stretch marks. So today I'm going to show you the stretch mark procedure using the carboxytherapy technique. So what you're going to see today is the carboxytherapy treatment for stretch marks. So today I'm going to show you, using a patient model of mine that I've been taking care of for the last year, how the procedure is performed. First I place a numbing cream on the skin, which is left in place for about 10 or 15 minutes. And then I remove that, cleanse the skin with alcohol, and then I'm going to fill the entire area with the carbon dioxide gas. And what that does is it prevents the gas from flowing out of each individual stretch mark as I treat each individual little scar. And stretch marks are a form of scar. And the reason that the carboxytherapy works in healing the stretch marks is that since they are a form of scar or collagen rupture, they don't have a very good blood supply. And carbon dioxide gas improves the circulation to the area, and it actually heals the broken dermal collagen. And it's a relatively painless procedure. It takes about 6 sessions, which can be done a week apart. If you can't make it every week, that's fine, because your body's going to keep responding to those treatments for the next 3 weeks afterwards. Usually a series of 4 to 6 are required. And it's safe for all skin tones. So unlike the only other option that we have right now for stretch marks, which is the fractionated laser resurfacing, which you can't do on tan skin, carboxytherapy is safe enough for everyone. And it yields wonderful results. And also another good side effect of the procedure is that it improves the quality of the skin. If there's a little bit of a cellulite issue, it's going to get rid of the cellulite and leave you with firmer, younger, more even-toned appearing skin. So let's watch. And today I'm going to demonstrate the carboxytherapy procedure for stretch marks. A very good friend of mine has graciously volunteered to act as a model. She's been receiving carboxytherapy for the past few months, and she loves the treatment so much that she comes back every week, so we've gotten to be good friends. Initially, the carboxytherapy what I will do first is I will fill the entire region here, this is her left thigh, with carbon dioxide gas, and then that provides a sort of anesthesia so that when I actually treat the individual stretch marks, she won't have any discomfort. So I'm going to begin turning the machine on, and it's one little quick tiny needle pinch, and the gas is now inflating a pre-configured area of about 5 centimeters around. As we all know, gas and water like to travel along the path of least resistance, so aside from keeping the gas in each individual stretch mark when I treat them, it also provides a form of anesthesia. So it actually works very well. So that's one little area. We're going to do another little area where I'm filling. This is just a tiny little needle. It's a 30 gauge needle, the same size needle that we use when we are administering Botox. So the second area is being filled here. The other benefit of this, although this particular patient is in excellent physical shape, she works out every day, she's within her ideal weight, and she doesn't have any cellulite, but one of the side effects of filling the area with the gas that is beneficial is that it also will eliminate any cellulite in the area, as well as improve the skin tone, because carbon dioxide has been shown as recently as June 2008 in the Journal of Drugs and Dermatology to cause collagen formation. So this will be the last little injection, just to fill the area with gas. We're increasing the circulation to the area. We're also providing the anesthetic effect, and as soon as I'm done with this little section, we'll get to treating each individual little stretch mark. Okay. So I'm just going to change the parameters on the machine. There we go. Okay. And now we're back, and here I am. I've inflated the area. Now I'm going to start treating each individual little stretch mark. And as you'll see, when I treat the stretch marks, they become just a tiny little bit elevated. That's the gas distending the stretch mark, and she's not having any discomfort because we've already pre-treated the area by filling it with the carbon dioxide. This is the Brazilian technique developed by a friend of mine who is a pioneer down in Sao Paulo, who has a very prosperous carboxytherapy clinic. Carboxytherapy clinics are as abundant in Brazil as Starbucks are here in Manhattan, so it's a very popular procedure, and hopefully soon more and more people will be coming to the United States and having this procedure performed. To treat the stretch marks like these are white stretch markers, stria albi, and they were caused because my friend was very athletic when she was younger, as we all were at some point. So we can only maintain that level of competitive athleticism for so long, and then we eventually get out into the real world and we have to have jobs. And even though she works out, probably not as much as she did when she was in high school. Same as me. I used to do gymnastics, but I can't work out for 5 hours a day because I have to come to work and help my friends. So the carboxytherapy, in order to treat the stretch marks, you usually have to do a series of sessions. Usually have to do a series of sessions between 6 and 12, but there's really no harm in continuing on as long as you see some benefit. I pretty much leave it up to the individual patient how many times they want to come. So that is it, the carboxytherapy treatment. These will appear to be a little reddish for about 20 minutes, but there's no limitation on her activity afterwards. One time I called her up because I needed a favor, and she said she was on the Stairmaster. So there's really no impact whatsoever on lifestyle, no downtime, and a very simple, and the only treatment that is effective for stretch marks that is safe for all skin tones. Carboxytherapy for stretch marks. Thank you for watching Dr. 212 Renew.
Thank you very, very much for inviting me into your home. I hope someday you'll come to my home here in the beautiful Upper East Side of New York City. Until then, I'm Dr. Lisa Zadinak, also known as Dr. 212 Renew, wishing you a beautiful day. Register for the blog! Register for the blog, www.dr212renew.com. It's going to be awesome. It's going to be a lot of fun. You know, I can't wait to come and tell you the newest things that I find around the world. So every day there's going to be something new, a new package waiting for you to open up and find out what's beautiful and new in the world. So again, please register for the blog, www.dr212renew. Register for the blog. It's going to be awesome. We're going to have fun. In the meantime, I'll talk to you later. Love y'all. Ciao. Mwah.